Good morning. I'm Dr. Shrikant Kain and proprietor and MD of Sarthi Specialty Orthopedic Center in Gavipuram, Bangalore. Today I'm going to discuss about budget 2024 and if healthcare has got enough money really in this post-COVID world. So I think in this year's budget 2024, Indian healthcare has been allocated around 2% of GDP. The original plan was to have 2.5% of GDP post COVID pandemic, when our healthcare was really exposed how bad it is. And if you look at the BRICS countries, even countries like South Africa, they spend more than 7% of GDP on the health. And even Brazil, which is almost a middle income country like India with its own problems, spend close to 9 to 10% of the GDP on the health. If you compare that to US, that spends nearly 17% of GDP on the health. So we are the poorest, investors in the health of the Indian people. And that's little shocking. And even if you compare the Ayushman Bharat, it is said that around 55 crores get an insurance of 5 lakhs. And the irony is that most of the people who are beneficiaries don't know that. And if you look at the thing, it sort of turns out to 130 rupees investment per year per head per Indian. This is what the government is investing in the health of the Indians. 130 rupees. And that's sort of on the gross, it translates to 7,200 crores. In 7,200 crores, what can you really achieve? People want to create AIMS everywhere. AIMS New Delhi is a state-of-the-art government hospital. Okay, just a building doesn't become a AIMS. It's the infrastructure inside which makes it AIMS. So when a bridge costs around 20,000 crores, what's the point in spending 7,200 crores for the health of the whole country, of 1.4 billion people? And also, if you look at what we are not taken into account is the quality staff. So just having a building and good infrastructure doesn't automatically translate into good healthcare. A good accountable healthcare means you need to employ quality staff, the doctors, healthcare workers. Where do you get them from? The thinking in India has always been that we can train auto drivers to become pilots, but as a pilot needs a lot of training, because in his hands or whatever 300 or 600 souls or whatever the flight can carry, and he can't afford to make any mistake. So same is that of a doctor. There's no difference. And those people who think that an auto driver can fly a pilot or living in a ivory tower, really. Okay, so for more such truthful messages, if you like it, please subscribe to this channel, like it, and please comment, and we'll bring more similar kind of information to our audience. So thank you very much. Till next time, goodbye. Namaste.